Okay, so welcome to this OET extra class. We're going to talk about text functions in reading part A. And I'm just going to show these guys my document and I'll discuss what my plan is for the study today. Can you all see this here? Should say
Yes.
OET extra there.
Yes.
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 Fantastic. So I'm going to start off with just a quick review of the technique. So technique review of part A reading. I don't want to spend a lot of time on this because I think most of you sort of know what my techniques are and use them. Is there anyone who's new in class today? Completely new, has no idea what my technique is?
I'm new, but not today.
Okay,
from
so
Monday.
maybe you're not 100% sure of this, so don't worry. I'll review that at the start and I'll show you what I mean. Okay, but after we've done that, I want to talk about topic and function. Okay, what's the difference between a topic and a function of a text? Can anyone tell me? It's dead easy. The difference between a topic and a text function. I'll show you later on. That's the second thing in this class.
Topic is like subdivision, like investigation, treatment, like.
It's hard to explain. I think it sounds like you kind of know what we're talking about, but I'll make this clear.
Headings.
I think the topic is like the concept of the text.
Is the
And the text function is what it likes to show to you. For example, a chart full of medicines,
like
the topic
malaria.
is treatment.
Excellent.
But the function is like the dosage of the
Nicole,
drugs and everything.
fantastic. So I'm just gonna sort of confirm that with everyone at the second part of this class. I'll show you some very simple examples and I'll explain why it's important. Okay. Lastly, we're going to talk about different possible text functions. And I'm just going to make a diagram for all of you. And at the end, guys, this is where I really need your help because I've got a nice list here, but I want your ideas as well. Hopefully we can make a really nice diagram for you to review later. Okay, I have put a note here. Note, no practice today. No like reading exam practice, right? We're just discussing text types. Okay, let's get started then. So my technique, right? I know people know this. Let me ask one of you here, maybe Clara. Clara, what do I usually advise for OET reading, part A?
Okay, about the technique?
Yeah, what's the first thing I normally recommend that we have to do?
The first, read the text and analyze it.
Yeah, so let's call this
to
step
try
one.
To get, yes, to try to get the main idea.
So step one, let's just put this here. So step one, read all of the texts. Yeah, read all of the texts in great detail.
No.
So we're just going to read all the text and analyze. What are we trying to analyze?
To get the main idea.
Something like the main idea. Something like the main idea, exactly. But when I often say main idea, don't I? But I think we need to be clearer. Like when I say main idea, do I mean the topic or the function? Which one?
Function.
The function.
It's more like the function, yeah. So I'll talk to you about that a bit later. But that's just step one, isn't it? Right? That's my step one. What is my step two? Let me ask anyone. Just put on your microphone and tell me. Well, firstly, Clara, how long does this take? How long should I be doing step one for? Approximately.
1 minute and a half?
I say about 90 seconds. Yeah, 90 seconds. You can do two.
Okay.
I've even had people who've told me they took 2 minutes, but they can still finish. Okay. So it's about 90 seconds though. Okay. Now, am I wasting time when I analyze it? Am I going to run out of time? What do you all think?
No.
Remember, it actually saves you time.
Yeah, saves the time.
Okay. And I'll explain that a little bit more in a second, because what is step two? Let me ask someone. Normally I'm much better with this. These days I'm getting sloppy. Alexandra and Amos, you know what after we've analyzed the text, obviously step two is
you scan for
the text.
Well, you answer the questions, right? You answer the questions and you're scanning. Yes. So answer the questions by scanning for
the keywords.
Keywords, right? And keywords are okay here because we're reading for specific details. We're not reading for main ideas. when we come to the questions, right? So for example, here, I know this is very small, no one can see this, but Amos, how many keywords would I choose here typically?
2, about 2.
Yeah. This is something that this is one of Paul's ideas. I really like it. He has like a primary and secondary sort of keyword. And he thinks about that in quite a sophisticated way. I don't really do it in a complicated way, but I'm sure when he's back, he'll explain to you. I think he uses them together, doesn't he? Like one word, you know what I mean? He explained it to me once. It was really good. Anyway, all I'm saying is, you know, if one of your keywords is bad, you should have another one like a backup keyword. Okay, so you choose 2 keywords. What makes a good keyword? Everyone together? Keywords must be
Unique.
And what does unique mean?
Only one.
Unique,
It's one
right?
or two.
It's not repetitive. It's
You
not
don't want
It
to.
is,
Yeah, go on.
It's
it is
not
not
repeated
repeated.
different places. Probably
Yeah.
it's only one sentence somewhere, one word.
If you choose the wrong one and it's repeated too much repetition, you're going to lose time, right? It's not going to help you. So you choose one that you think is the most unique. It's quite easy, really. But then what am I doing?
You are scanning
I'm scanning. Am I scanning all the texts, Amos?
particular section.
Maybe just
Well,
one. Hopefully one, maybe 2. Should I be scanning 4 or 3?
No.
Lots of
there's
rhetorical
a lot
questions
of-
today. The answer is
No.
no, right? You're not going to be scanning 4. If you're looking in 4 different texts for every question, what will happen?
can't
Uh,
finish.
Run out of time.
I have the same
You
problem.
run out of time.
Yeah. So you should know which text to look in. So Jane, how do I know which text I should look in? How is it that I know to look in text B here? I already know.
Because you read all the text and analyze.
Because of the analysis, right? This analysis saves you time because you don't have to then read all the text all the time, okay? Sometimes you'll have to read 2 texts, but you shouldn't be reading 3 or 4. All right, so this is an overview now of my technique for part A. Step 1, read and analyze the text. Step 2, answer questions by scanning for keywords in the text, and you already know where to look, more or less. Okay, now the hard part, the whole exam is hard, but one of the hard things to do is step 1, right, to analyze the texts. So I want to do more work on this today with all of you, right? We're going to work just on this today, because it's not easy to do this in 90 seconds. It's not easy at all, even for a native speaker, okay? So I want us to think about how we can do this better. How can we get better at analyzing, all right? And the first thing we're going to do is just think carefully about what are we doing when we're analyzing texts? What are we trying to do? Let me just put this here. I'll show you an example, right? You guys, you've seen me do this before, but let's try and think about what am I trying to do here, right? So if I share my screen, you will see a text. You will see a mock test now. 1 second. Where's the mock test? Here it is. Can you all see now tetanus? It should come on your screen. Tetanus texts.
Yes.
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 So we'll just do a very quick example, okay? You've seen me do this before. This is just an example. If I'm analyzing this text, I'll just use one of you to help me. Maybe Amalia, if you could help me, Amalia, and Ling.
Hello.
What am I trying to do here? What am I doing? What am I looking for? What do I do?
Definition.
So main idea. Someone said main idea. Read for the main idea. Yeah, in a way.
Definition.
So read for the main idea. Yes. Okay, so I've read for the main idea, and I'll tell you the main idea. Ready? The main idea is tetanus. It's
No.
about tetanus. Is that okay?
No.
No.
Is that going to help me?
No.
I have to go into a bit more detail, don't I? I can't just go. That's the topic, isn't it? That's not the. It's not the function, right? So what we usually do is we might look at
Definition.
first. Well,
Definition.
sometimes you have to break it up.
Yeah.
So this is different from the rest of it. What's happening in this?
There is definition and
Definition.
Yeah, introduction and symptoms.
Symptoms.
It's some kind of definition, and yeah, it's including the symptoms, but it's kind of like saying you kind of know it's a definition because it's saying is a severe disease. Yeah.
Also a cause. A cause.
Causes. I'm going to put all those together and say that's a definition. Usually, when you define someone, you say like the severity, the symptoms, and the causes. Okay, that we have to choose something. We can't do all of them. Okay, but it's actually quite different from here, isn't it? Look, that's not a definition.
This is the symptom. Symptoms.
Symptoms.
Is it just the all symptoms?
Early symptom.
Early symptoms, right? So early symptoms.
Also,
What else am I doing at the end? Yeah, what other thing kind of analysis?
Complication.
And then specific diagnosis.
Complication and
Is it complications?
Diagnosis.
Go on, you can all shout out. So complications, it looks like. Let's just say for now, for the example, complications.
Yeah.
Okay. So what I'm talking about is what we're gonna look at today in more detail is this idea that you look at the text and you analyze them, right? You're not looking at the topic. You're looking a bit deeper than that, but also you're not usually looking at specific things, right? Not usually. Okay. Now let's go back to that question again, because I think it was Nicole. I think it was you, Nicole.
Yes.
You had a great. I said right at the start of class, what's the difference between a topic and a text function? Remember that, everyone?
Yes.
Just put this here as an example of analysis. All right, so what is the difference between topic and text function? That's our next question. Can everyone see my document now with these two texts?
Mhm.
Yeah. Yes.
Very, very quickly, you've got 15 seconds.
First, it's
Nicole, I know you know how to do this, but let's just wait for everyone in the class. Read both texts and tell me what is the topic and what is the function. Just 15 seconds, right? So very, very quick. Topic and function. And Nicole, I'm going to ask you to answer us when those 15 seconds have finished. You've got 10 seconds left. Okay. All right. So, Nicole, what is the difference here between these two texts?
The text topic is the first one. It's about needles and history of the needles.
Okay, so this is telling me about needles. Okay, that's
Yes.
the topic, isn't it? What's the topic of
Exactly.
this one? What's the topic?
It's how to use them.
Is that the topic or is that the function?
That's the function.
That's
The function. What's the topic here? It's not needles, but it's almost the same, isn't it? What is it?
location.
Procedure.
Injections, right?
Injections,
No.
right?
Yeah, applications.
The topic is almost identical, but the function is completely different in these examples. What's the function of this text, Nicole?
The first one is history.
It's just a history of needles. I just Googled history of needles. So the oldest needle is 60,000 years ago. Really? I didn't even read this. That can't be true. 60,000 years ago? Okay.
And fact.
I bet it wasn't very good. It was probably just a stick. Anyway, what about the function of this one? The next one.
It's how to give an injection.
I like that. How to. It is kind of like a how to. And
Or
when we
kind
see
of a
this,
step by step.
I'm going to go for something like step by step or instructions. Yeah.
I think that's instructions. Yeah.
We're going to talk in more detail about this because when it comes to instructions, it seems like there's different types of instructions, right? This seems like a sort of step by step approach, but you could have instructions where there is no 1, 2, 3, 4, 5. Okay, so I'm just making a simple point, guys, that the topic is something different from the function, and we're not really interested in the topic in OET reading part B. We're interested in the function of the text. So I'm going to show you some more text now, and guys, you could tell me, please, what is the function of these two texts? Come on, isn't it the same or different?
Different. Looks like
What's
Which
the
one?
function here? What's the function of this one?
talking about British Isles.
That's the topic, right? So here the topic is different. Topic is history of Britain, right? Britain. What's the function? Everyone?
A little bit of history.
History.
History, the history, right? This is very, very easy. This is supposed to be easy, this bit, okay? Next bit, topic and function. Topic is?
Injections.
Injections. And the function?
Instructions.
Instructions and steps, I think.
Instructions, and we said step-by-step instructions, okay? So here, what you can see is that it's exactly the same as the other one. What's the difference between this one and the last one? Come on, it's so easy. These two texts are almost the same as the other two texts.
It's a different topic.
Just the topic is different, right? But the functions,
The same.
they remained the same between the two, yeah? Between this one here and the other one. Okay, so we need to think in more detail about this topic, and I want to talk about what's the most important thing again. Is it the function or the topic that we need?
Function.
Function. Okay, so what possible text functions are there in OET reading part A? Right, let's think about this now. What did we just see?
Instructions step by step.
Sure, we saw it in, well, when we analyzed it in the OET example, it wasn't instructions. You can definitely have instructions, but what did we see here?
Definition and symptoms.
Yeah, right. Good. So let's talk about these then. So there's loads of possible functions. I want you guys to think about possible functions now. One might be instructions. Okay, I'm going to ask someone else in the class now, though. How about Manuela and Marwa?
Yeah.
Possible functions, text functions, instructions. We could have, what else? History,
Management.
right? Management, okay. How to management. Anything else?
Advice.
Ah, yes, it could be an advice text. Okay, advice text. What else?
Dosage.
Now I'm going to say,
Education.
In the management.
if someone gives you dosage and schedule, what are they giving you?
Management.
Treatment.
Seems to me like some kind of instruction, doesn't it? So
Yeah.
there's different types of instruction. So I'm going to say there's a dosage. That's usually a table, isn't it? It's usually a table. So dosage and schedule. What else?
Various treatment options.
Treatment options. Who said that?
Pratik,
Pratik. So treatment options. Okay, like give me an example.
like if some disease is there, then you can treat it by the paracetamol, antibiotics.
Yeah.
various
Do it like
treatment.
this. Do it like that. Yeah. Okay. I'm going to ask you guys to give me all your ideas here, and then we'll try and apply these. So yeah, who's that? Go on. Who's the side effects? Someone said. Who said side effects?
I said side effects.
Yeah, side effects. Okay, it could be a text all about side effects. But what's the function then?
Complications.
Warning.
Warnings. So I wrote that one down before the class. I'm going to say problems and issues, right? So what else, guys? Don't get confused with the topic, right? It's the different thing, the function. Anything else? You can shout out.
Maybe
Explanation.
Oh, I can't hear you very well. Again.
Complications.
Complications. So complication, possible
How to
complications.
diagnose.
That would be problems and issues, wouldn't it? What about indications and?
How to diagnose. Like step by step to diagnose.
Yeah. So
Criteria.
I'll come to that one in a second.
Contraindication.
Indications and contraindications. What does that mean, Han? Contraindications, indications.
Indication is just in which situation you can apply that one called contraindication, like just you have to avoid that. For example, like if the patient is old, elderly, you can use that.
Okay. Yeah. And if so, yeah. So I that's definitely, you could have a text talking about. I think that's a separate function, isn't it? Is it giving me advice though, or is it giving me? What is that, an advice, guys?
It's like an advice, but a warning also.
Awareness.
It's like a warning. Yeah, I'm going to move it over to here then. Okay. What else? Someone said diagnosis before. I like that. But again, diagnosis is a topic. What's the function of diagnosis? Like how?
The step by step. How do you get to that diagnosis?
Now I wrote down before class how to.
Various investigation options.
Yeah, I'm gonna call this, and I want us to think about this carefully, guys. How to? What does that mean? How to? I'm going to ask Vino, just Vino. How to? What does that mean?
How to diagnose? I thought different pathogens.
It could be anything though, right? It's not just how to diagnose. It could be loads of how-tos. What's how to? What is it?
How to classify.
Explanation maybe.
Classification.
Well, it could be how to diagnose. It could be how to classify.
Maybe
Yeah.
types also. Diagnosis, investigations, and types.
How to treat. How to treat.
Treat, thank you. Okay. But what does it mean, how to? But
Methods.
you obviously all know, but yeah, thank you, Han. Methods. How to
Direction.
treat. How about how to assess? Right? How to assess. How to treat, how to diagnose. I suppose is that the same as diagnose?
Specimen. Yep.
Yeah. I'll put
How
that.
to investigate, investigations.
How to invest. So what do you mean? Do you have to show someone how to investigate? Yeah, okay. So how to here. Think about function now, guys, though. How to investigate,
Yeah, various
how to treat, how to
investigations.
okay. I'm going to change diagnose to assess because I think it's easier. Think about text function now. Is there anything else? I've got other things here. What about if I say, here is a wound and there are 6 types of wound? That's not advice.
Classification.
Classification texts, right? Classification. I'm gonna give you more examples of these in a second, but let's just get all the possible types of text on the board. Anything else? I can think of
And
more.
then also
maybe-
information, because sometimes you got like charts or graphics of information, like
Well,
data analysis.
But I want to separate a table, right, from this. It's not tables can have different functions.
Yes.
Table could be an instructions like do this when this happens, or it could be something else. It could be advice or something like that. Han, did you want to say something there?
Yeah, I think maybe treatment option we can use like specialist or multidisciplinary, where you can find like cooperation. For
Yes.
example, yeah.
So
Like if the patient discharge, maybe you need to nurse, community nurse, or maybe physiotherapist or something.
Right. So like, yeah, that would be a subcategory, wouldn't it? So it's basically the person.
Like interdisciplinary.
Okay. So give me one word for that? Shall I say the specialist?
Yeah.
Specialist required, something like that.
Yeah.
I think I know what you mean. Person
And
required.
support services as well.
Okay, but that would you agree that that's giving you options for treatment? That's the function, to give you options. Yeah. Management. What's the function of management?
Drug therapy protocol.
It's a bit like how to protocols.
Protocol, yeah.
Yeah. What about something that just tells you symptoms? Would that be a description?
Definition.
Of some kind? Definitions. Yeah. Have we got definition there?
No, it's more like a description.
Definition, right? Or description. It's the same thing, isn't it? A definition and a
Yeah.
description.
Yes.
Okay. So that could be symptoms. What else is going to be there?
Maybe
Symptoms.
level as well.
Levels. Okay.
Complications.
Now, think about the exam. We know that the text will be short. There will be 4 of them. And we know that they're supposed to be practical texts. Where do we find the texts? Where are they supposed to be?
In the beginning.
Yeah, but I don't mean in the exam, sorry, yeah. In real life, where do we find text like this?
Workplace.
For example, in a
Workplace.
report.
Well, in the workplace, in a hospital or a clinic. So think now, guys, about text that you've seen in your hospital or clinic. Is there any other functions that we're missing? Just think we've got everything here. Instructions, history, description. That's everything for me that I wrote down. Oh, there's one more kind of thing. I want to separate guidelines from advice. I don't know what you guys think. What do you think about this? Guidelines and advice.
Guidelines is more like a rule. Yeah, a technique.
You know, like the language for
it's like
the language of
more-
advice is like you should do this, you should do that, right? But guidelines is more like it doesn't say should.
Is
You know
it
what I mean?
Yes,
Like a
so
protocol.
kind of technique.
It's like
Yeah.
a
Is it,
protocol, and the other one is specific.
Way to do, safe way
Yes.
to do. Yes.
In general,
can I ask you a question?
Yes, please.
Sometimes these text functions, you get something like a flow chart. Like for example, anemia, mild, moderate, and
Charts.
severe.
But they're not
Yeah, like
functions
flow
themselves, are they? Yeah. When we practice classifying in a second, you'll see that, look, for me, a chart could be, sometimes it says dosage and schedule, Well, that's just instructions.
Yeah.
But the chart could be a chart of types. It could be a types of wound. Well, that's classification. What about management, though? I don't know if management, is that actually a text function? What's the function of that?
Yes, for example, how to manage a wound.
Should it be here? Should it be
Drug
here?
therapy, yes.
Yes.
I'm going to put it here, okay? So how to is a big one. It's you often get how-to style texts. Okay, I need one more idea. Does anyone have anything else we could possibly get? I can't think of anything else you might see in the exam.
Recommendations.
Just numbers, such as
Recommendations?
probabilities.
Recommendations is advice.
Also
That would be
like
advice.
yes,
Advice or
advice
guidelines.
or instructions. Yeah.
Anyone else?
Probabilities, such as charts of
Psychology.
numbers.
Probabilities. So that would be, what's the
Like
function of that
statistics.
text? Okay, statistics.
Statistic.
And what's the function to just tell me facts?
Yes,
okay.
such as, I don't know,
Facts.
7% of the population
Statistics.
have
Yeah.
such disease.
And we saw one of those recently in one of the mock exams. So yes, okay. Now, before we're going to practice classifying text in this way, according to function, but does anyone not clear about some of these? Because you can ask me a question now and we can discuss it. Like, for example, if you imagine you see a text and it says this. Okay, so if the patient has these symptoms, you can insert an IV, or you can prescribe them oral medication, or you can give them CBT psychological treatment as well. What's the function?
Advice or treatment option.
I was
It's
just giving
how
three.
to assess the patient.
Ah, no, I was saying or. What's or? That's an option,
Options.
right? Okay.
Yeah, option.
Diabetes has been around for about 200 years now, and we
Definition.
know it's a very difficult. Well, it's
History.
more like a has been. It would be more like. But I see what you mean. It could be also those two could be close, couldn't they? All right. So there are three types of diabetes. There's type 1, type 2, and type 3.
Classification.
Maybe you have more than one function per text.
Well, didn't I show you that already? It almost always is more than one function. Okay. So I was going to reinforce that later. Guys, don't think that you're just going to get one, right? You might get 3. But the reason I'm doing this class is because, as I said, I did a one-to-one, and when I said to this person, I said, well, what functions are there? And she couldn't really think of any. We could only think of about 3 between us. So now we have like 9 or 10, okay? But I want to make sure everyone understands each of these. What about this? Tetanus can lead to many problems. One of the problems is I've got no
Problems,
idea.
issues.
Problems, yeah. Okay,
Issues,
if you when you finish washing your hands, you should when washing your hands, you should spend at least 2 minutes, and you should
Instructions.
Instruction.
Instructions.
49% of all females who take this medication. Statistics, right?
Statistics.
Is everyone clear on this now? Or
Yes.
Does anyone want to ask me anything at all?
It's clear.
And we're also clear that it could be more than one for each text.
Yes.
Yeah.
Yeah.
Okay. So I'm going to get rid of this. Microphones off,
this
please.
video? Is it saved?
It is saved, and you can get the document as well. Okay. Unfortunately, that's a bit. I'll clean that later. Okay. So the next step of this class is obviously just to go and do it now, right? Let's try and apply this to the actual real texts. Okay. So let's go back to this one again. Can you guys all see this?
Yes.
All right. And in fact, I think I'm going to share my, I'll move backwards and forwards now. So one more time, guys, what did we say before? This is a
Definition.
or exactly the same as description, isn't it? Right. This one?
Symptoms.
Early
Symptoms.
Symptoms. Is that problems? Is that how to?
No.
It's just a list of symptoms, isn't it?
Yeah.
Did I separate that as something? Is that we didn't have just
No, it's
symptoms?
inside definition.
It's like a yeah.
Symptoms levels.
Thank you. I was confusing myself there because it makes sense now, doesn't it? That text is defining, and as a part of the definition, it gives the symptoms. Okay, great. Okay, let's go back to this then, and let's look at text 2. All right. A tetanus-prone wound is, what's the function of this? Let's have a look.
Definition?
It's a definition.
Little
Yeah.
definition at the start, and then, so we know we might get some, what's that?
Instructions, yeah.
Instruction, advice.
It's like a guideline. Oh,
I think this is more like, let me just let this person into the class. Is it guidelines? No, it's no, it's not. What is this?
Instruction.
Some kind of instructions. Any bite, I think this is a definition, isn't it?
Yes.
Definition.
I think it's instructions and definitions.
Well, if it's instructions, it's telling me to do something. Is it telling me to do something?
No.
I can't see it saying you should do this. You should.
No.
I think this will be a definition because look, it's the same, right? It's just telling me this is what a tetanus prone is. Okay.
Yeah.
What about this though? That's not a definition, I don't think. What is
That's
that?
what to do in a certain time.
Instruction.
Intravenous drug users are greater risk of tetanus. Every opportunity.
it's like a consequence.
Warning.
Warning,
Like
advice.
a risk
It's a bit of a
factor for
warning,
tetanus.
isn't it? It's a bit of a warning. I like that. Should we have that as a separate category? Warning. That's problems, isn't it? That would be problems.
Yeah,
Where
there
would
is a
that
lot
be?
of warning
They're the
actually
same
in the
with
thing.
advice.
Barry, go on, put your microphone on. So a warning, does that fit into our categories or do I need to add in a new one?
Okay, let me just scan it 1 second quickly. Okay,
What do you,
treatment,
and you guys, what do you all think as well? Is it?
guidelines, history.
Problems or
Maybe it's
issues.
like problems.
I think issues
I'm
and
thinking,
problems.
I'm thinking issues and problems. And if I just,
Consequences.
I'll just add in, because it's all the same idea, isn't it? If I tell you a problem, I'm warning you, aren't I? Right? Because you're a medical professional. You're not going to go, oh, okay, I'll go home then. Right? You'll try and sort it out. So it's kind of a warning here. All right. But I'll leave that for now. Okay, so back to this one. Let's try and analyze this next one. It's a table, but that doesn't tell us the function. What's it doing?
Classification.
I think it's some classification here.
Yeah.
What else?
And treatment.
And treatment.
Classification and treatment. Yeah. Okay. What about, great. What about these footnotes? Oh, got to watch out for them.
Extra.
What's the function?
Warning.
It's kind of got an extra
Advice.
function. Yeah.
Yeah.
You don't know what's going to be in here. So a little tip, maybe don't think about the function of this, but pay attention to it and just double check. So that's saying, just take note of this. That's talking about tetanus spores, immunoimpressed. You know what I do? What do you guys do when you see footnotes like this? I think it's a different thing. You can't think about function so much. Footnotes.
Advice, maybe advice.
Sometimes I just write down keywords. Does anyone ever do
Yeah.
that?
Yeah. It's like the details with my idea.
I just go, okay, immunosuppressed, and I might
Or
write down
5 doses.
tetanus
5
spores.
doses. Yeah.
Yeah.
5 doses.
So a little tip.
Extensive,
just-
devaluated
just grab some keywords for footnotes. All right. I'm trying to move this on fast though. So D. Remember in the exam we've got to go fast. So again, it's another table, but it's not really the same. What's it doing? What's it telling me? Dosage and
Indication and
Treatment.
indication.
so one of the things is indications and contraindications, right? What else?
Adverse reaction.
Side effects. So that's problems, right? So problems, contraindications or indications. And what's this?
instructions.
Dosage.
Dosage. What did we say that was? We said that would be instructions, I guess. That's instructions, right?
Yeah, it's supposed to be.
Like you shouldn't give more than this. Otherwise
Yeah,
it's
because you're
dangerous.
instructed in 10 things, what to do.
Is everyone okay with
Or
that as
maybe-
being instructions? I think it is. Yeah.
Or guideline, Alan. Can we say guideline as well?
Well, the thing with guidelines and advice, it's not clear to me the exact difference, but it could be guidelines, yes. Guidelines is not a very clear idea for me, okay? But as long as we get, to be honest, if you just wrote down instructions or guidelines, it would probably be okay in the exam. Okay, let's try one more. So I've got these all lined up now, okay? So that was, oh, it's gone.
Alan, this is very good because it makes more actually more and clearer and more connected to it.
Good, good. I hope this is useful, guys. So look, as I say, I've not done this kind of class very much before, so I hope we can work together on this.
It's good practice, very good practice.
So what's this one, guys? Function of this?
Definition.
Identification.
Definition in the first line.
Definition and the
Description.
classification.
Right,
And
is.
classification.
Imagine if I say to you, hey, what is this? And you say, oh, it is a severe, rare, potentially lethal soft tissue infection, right? Okay, what's this though? That's not.
Classification.
I think I would go with classification type 1, type 2, type 3. So we would write down here, we would write down definition, classification. I think we could probably move on. Yeah?
Yeah.
I don't think there's anything else. So just 2 words we would take from that. All right, this one.
Treatment.
Treatment option.
Treatment
According to
and
type.
And
Antibiotic.
treatment options.
Guideline.
Pratik gave us
The
that
warning in the end.
There's a warning at the end, but there's also classification, right?
yeah.
Type 1, type 2. Again, so treatment options, classification, warning. Move on to the next one. Okay. This one, tricky because there is no subtitle. There's nothing to grab onto. So just take a few seconds to think about it. What is this text telling me? What's its function? Is it history? Advice?
Why? There is advice.
Investigation.
How to support the
How
care.
to assess.
I
How
think
to assess. Yeah.
it's
Guidelines.
I don't think there's advice. I think it's in instructions.
Yeah, instruction like
This is one where it's a bit tricky, but we do have look should begin. Okay. Supportive care in the ICU is critical to survival. This is almost like a mix.
It's a guideline.
And treatment options.
To me, this is almost two different things at the same time.
Guidelines
How
and
to
instructions.
Management.
Okay, so
It's
firstly,
guideline.
it does have should, so it is advice, right? There is some advice in there. Some of you guys are saying guidelines.
Advice and recommendations.
Is there recommendations there? I think that's advice. That's advice. Is there anything else apart from advice and guidelines here?
How to manage like necrotic fasciitis.
Isn't that just advice for how to manage?
Yes.
You know, when I think of how to, I think of step 1, step 2, step 3. That's how to do it, right?
Even on D is the same advice.
I think this is advice and guidelines, unless anyone's got a good argument for me being wrong.
And treatment
Or
options.
can we say procedure?
Ooh, where's the treatment options? No, procedure is not a function, right? That's
For
just
example,
yeah.
in the second paragraph, when
There
it
might be some
mentions
treatment
the
options.
VAC,
for wound care.
With VAC, the patient's wound decreases sign. And what is that? That's a strange one. Vacuum seal was recently able to be effective. No, I think we're okay. I think we can just go with these 2.
Critical care, advice on critical care.
Okay, critical care. Now, as I did with you remember when we saw the footnotes? This is what, I know Neshka does this. She's quite good with her scores. Sometimes you can just write down a key word if you're not sure. So I think here we might write down, what's VAC? Something like that? Or
can we write advanced wound dressing?
24-hour.
just maybe grab 1 or 2, right? That's not the function of the text, but you think it's important, okay? So that's all right. There's no rules for this, yeah? But that's not text function. Okay, this one, D, easy.
Advice.
So I could write down advice, but why don't I be a bit more specific? It seems like there's 2 types here, right? There's advice for
Before
discharge, and there's also advice for
like regular patient and a diabetic patient.
advice for diabetic. Yeah, there we go. So it's getting quite fast now. I like that. I had one more lined up. Just give me 1 second because it's closed down. This one should be test 1. Okay, again, we want to try and apply these basic functions to the text. We're not interested in topic so much because the topics are all the same. What's the topics of these, guys? Topic today.
Feeding tubes.
Feeding tubes.
Feeding tubes, right?
Feeding tubes in
And
pediatrics.
you know that you're going to see 4 texts, and in about 90 seconds, you just want to try and think about function. It doesn't have to be perfect, But you know, instructions are very different from history, and how-to is very different from facts and statistics. Definitions are very different from advice, right? So you want to get that clear in your mind because it will help you later on. So this one, what do you think?
Alan.
Yeah, go on.
Yeah,
I'll just take it back to this.
I've heard about a diagram as well.
Say that again.
Diagram, for example, any paracetamol poisoning, and they give us a day, which day? Yeah, we call it diagram, isn't it?
Well, for me, the diagram is the form, right? Diagram is the form, but not the function.
Okay.
Right? You know, a diagram can be advice, but a diagram can also be facts and statistics. You see what I mean? You can do anything you want with a diagram, more or less. Okay? So don't get confused by that. Just go into it and say, well, what is this diagram doing? Right? What's its function? Okay. This is nice because I've got a subtitle, so I already know a little bit about the function. What's the function?
How to use?
How to use?
How to, yeah, how to use.
Guidelines.
How to use, it's the gastric tubes, yeah? Okay, what else is it telling me? Issues associated with, that's not how to.
Yeah.
Problems.
It's problems or warnings or issues, right? Problems. Yeah. Okay, so that's it, done. Okay, let's go on to the next one. Text B. Insert the gastric tube.
Types of
Types of
yeah.
gastric
It's a
tubes.
classification, isn't it? It's classification. What else?
And procedure.
Instructions.
You know, if you want, you can just write down types, because that means the same thing, right? Types is the same as classification. So types, is there instruction? Yeah, there is.
Yeah.
Yes.
Give me what's the first instruction here, the first one.
Wash on the dry hand.
Position for the trash.
Point.
I think it's wash and dry hands. So there's definitely instructions, or this is kind of how to insert the cannula, is it?
Yes.
Yeah, and you've got a wide one and a, yeah, so it gives you two types of, am I saying that right? Cannula?
And there is
Yes,
also
cannula.
And then cannula, sorry. And then you've got instructions here. Okay, next one. Don't freak out. It's not as complicated as you think. Just think about the function. If this, do this. It's something like guidelines, isn't it? Right? It's something like guidelines, like
a protocol.
Or a protocol, yeah, which is kind of the same meaning. So it's saying if do this, yes, no. So for me, all of that is just yes, no guidelines.
Maybe it's indication and
when to
okay.
not to
If you want, you could also put in indications. Yeah, I like that. What about the top bit though? Is that the same at the top?
No.
It's an information, I think. Like
Yes. Yeah.
Estimate the measurement. Warning. Insert. No, it's guidelines again or instructions. Look, insert fully. Guidelines or instructions, right?
And
okay.
on the end of
yeah, you got to check this. Yeah, exactly. I don't know what that is, so I might write some keywords down. I might just PH.
Why don't you?
Warning.
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 Yeah.
Warnings. Issues. It's interesting how you often get issues at the bottom of the
Why
text.
not a beta blocker like a metoprolol?
Ah, so Amos, if you can do that, if you can pull that out, write that down, right? That's or memorize that. Okay, text D.
Yeah. Types of these and also
Instructions.
Instructions.
I think it's kind of instruction.
Administering feeds via a tube. Feeds are ordered through a dietitian. When feeding directly into the small bowel, feeds must be advice. Look, if you see should or must be,
and also warning.
Some of it's advice. Under no yes, you're right. So we've got advice, warning.
Warning.
Should be monitored.
What else? Monitored.
In bottles, there's also
measured.
Yeah, and as I said before, I'll just finish with this. If you're ever just feeling like,
we can say protocol like use these feeding methods would be. Protocol.
Feeding.
Yeah. And also instructions.
Yeah. So guys, I just want to finish this, but yeah. There's lots of good ideas here. Look, there's nothing wrong with just pulling out what you think is, even a keyword is okay, or maybe a short phrase. You can put in, there's some flexibility here, right? You have flexibility with this technique. I spoke about this before, but I'll finish on this. I was teaching a doctor once, and she said, so this technique, Alan, what you're doing is you're just making an index. You're indexing. So what does indexing mean?
Listing.
She was right.
Like make a list.
What is an index?
List of topics.
It's a guide.
A bit like a guide. It tells you.
Yes.
It's a guide of where to.
Guide and where it is located. We can
reference
get
where
idea where it is located.
I'll get rid of this. We don't need this, but I'll just say I'll finish with this. So look, in some ways, when we analyze at the start, not exactly, right? We are trying to index, okay, the functions of the texts. An index is in a book. You know, when you were studying in your universities, right? You know, when you took an academic book and you wanted to find out where something was.
Yes.
You turn to the back, right?
Mm.
An index is at the back of an academic book, and it just tells you where everything is.
So basically, it's kind of located the information in a different places.
Well, yeah, we are trying to help ourselves, aren't we? We are trying to help ourselves locate the information we need later on. That's it. Okay. So guys, review this. This will be available on the study document from this week. I'll post it into the Skype chat as well. And just have a think about this yourself. And next time you're doing a mock test or something, or next time you're reading anything, just think, what is the function of this text? And don't confuse it with the topic, right? The topic is different from the function, obviously. Okay. Any more questions before I finish? Does anyone have any questions about this diagram?
Sorry.
Yes.
At the exam, are we allowed to write the function on the side of the text?
Yeah, the only time you're not allowed to write, there's only one time you're not allowed to write on the paper. When is it?
Writing.
These are like writing
for 5 minutes, yeah. Now, some of my students, you might want to start off writing it, but some of my students have said they just kind of like memorize it. They don't need to write it down. Just do whatever you feel comfortable with.
Okay.
The main thing in part A, though, is of course time management. Okay, so you want to try and do all that in about 90 seconds, maximum 2 minutes. It'll save you time later on, but you can't spend longer than 2 minutes doing this. Okay, so practice is key. All right, I'll say goodbye there. Thank you very, very much, everyone, for watching.
Thank you, Alan.
Thank you.
See you guys. Have a lovely day. I'll see you tomorrow. All right, take care, everyone. Bye bye. Who was that?